From Denver 7, this is 7 News.
You know, it seems like the guidelines are changing all the time when it comes to women's health. So it can be kind of confusing for women to know about the yearly exam, when to go, when they shouldn't go.
Oh, yeah, and I always have to keep calling my doctor. So should I
What's
get
the rule
this
now?
exam or not? Well, Dr. Vandna Jerath with Optima Women's Health Care at Parker Hospital joins us this morning to help us sort it all out. Doctor, thank you for being here.
Thank you for having me.
So let's start with how cervical cancer screening guidelines have changed.
The American College of Obstetricians and Gynecologists have reviewed a great deal of research and have made some evidence-based changes in the guidelines. Typically, as OBGYN physicians, we always used to do an annual pap smear on all of our patients yearly. However, now they've made some changes, and they are confusing, but the simplest way to look at it is that it answers 3 questions. When should I begin getting a pap smear? How often should I get a pap smear? And when should I stop getting my pap smear? So the new guidelines indicate that you should start getting a pap smear at the age of 21, regardless of when you become sexually active. If you're between the ages of 21 to 29, you should get a pap smear every 2 years. If you're over the age of 30 and you are a low-risk patient, have never had an abnormal pap smear, then you can have your pap every 3 years.
Wow.
Okay.
So that's a large change in the guidelines.
Absolutely.
Also, if you're a woman who's had a hysterectomy and had your cervix removed for a benign reason or a non-cancerous reason, then you can actually stop having pap smears if you're, again, a low-risk patient.
As long as you're low risk. Talk about the risk factors for cervical cancer.
The risk factors for cervical cancer, there are several, but one of the main ones is the HPV virus, the human papilloma virus, is 95% of the cause of cervical cancer. Other risk factors include an early onset of sexual activity, multiple sexual partners, history of sexually transmitted infections or sexually transmitted diseases as well.
Okay.
Okay, what about the HPV vaccines? Obviously, we've been hearing a lot about that. Is it safe? And should women, when they go in, should they be tested for that specifically? Do you have to ask for that?
The HPV vaccine is safe. It's been tested worldwide with over 40 million women now. It's considered safe and effective. It's effective against HPV types 16 and 18, which are 70% of the cause of cervical cancer, as well as types 6 and 11, which are 90% of the cause of genital warts. It is recommended for girls, ideally age 11 to 12 prior to becoming sexually active, but is FDA approved for girls as early as age 9 and as late as age 26.
So it is much younger than I would have thought.
Yes.
Yeah, for families out there looking to get their daughters vaccinated.
Yes, indeed.
They can start doing it before their teen years, essentially.
Absolutely.
Okay, very good. Well, good information. And when we have more information about our screenings, we'd like to put it on our website so you can read more about it. If you'd like to go there, you can go to thedenverchannel.com, click on that big red TV button, and you can read up more about it. But good information this morning. Thank you.
Great. Thank you for having me.
Thank you. We appreciate it.